Good afternoon, but also good morning and good evening to many of us. It's our real pleasure to welcome you to our first webinar in the new series of alumni webinars featuring the ITM winners of the Prize for Global Research 2022. This prize is awarded yearly by the province of Antwerp to research projects of master after master students of ITM and other higher education institutes. In this first webinar, MPH alumnus and laureate Joseph Djoki Bahati from DRC will present his master thesis entitled Humanitarian Aid Agencies and Responsible Exit in Fragile and Conflict-Affected Settings, a case study of Zummar Project Iraq, MSF Switzerland. The main aim of these alumni webinars is to share research findings, expertise, and experiences on a specific topic within the ITM community of alumni, students, staff, partner institutions, and the wider global health community. I will now briefly explain some of the practicalities. If you would like to ask a question, you can use the Q&A option you have below your screen. If you want to ask your question in live, you can raise your hand at the end of the presentation. The chat is being disabled for questions, and only questions will be moderated, but only a select number of questions can be answered in live, given the limited time. Unanswered questions cannot be answered individually afterwards, for which we apologize. But you can, however, use the forum function in the alumni platform to start a discussion on the questions left after this webinar. At the end of the webinar, a short survey will be displayed and a browser window will open to give your feedback. The webinar is being recorded and will be made available afterwards on the ITM alumni platform. Our today's moderator is Marlon Garcia Lopez. Marlon is a senior expert in public health and humanitarian relief. After his MPH studies at ITM, he worked more than 10 years for international organizations, such as also MSF France, both in Paris and in several Latin American and Asian countries. Since 2014, Marlon is working at ITM as a program coordinator for the Master in Public Health, as well as for the advanced short courses, Health Policy and Systems Research Methods, Health Policy and Governance, and Social Protection in Health and Health System Strengthening. Marlon, the floor is yours, please. You're muted.
Okay, good afternoon to everybody. Thank you for inviting me to moderate this interesting session. I would like to introduce a little bit more Joseph. Djoki Bahati Joseph is originated from DRC, Congo. He is a medical doctor and a public health practitioner. He is looking back into 10 years of his experience. He firstly served as frontline health worker. He also has been acting as hospital director and a health district manager in his home country. But since 2016, he joined the humanitarian work, and he was deployed in 5 fragile and conflict-affected settings across Africa and the Middle East. With his last assignment being in Iraq as a medical coordinator for Médecins and Frontières programs, he was, after that, interested in following for an MPH degree at ITM, which he obtained in 2022. And during this MPH, or before, he has developed an interest in the sustainability of humanitarian aid and the health system strengthening. So I'm honored to moderate his session, and I give the floor to Joseph. Please, Joseph.
Thanks, Marlon. Yeah, let me share my screen quickly. Yeah. Yes. Can you see my screen, Marlon?
Yes, now it's okay.
Yeah, thanks. Good afternoon, good evening, and good morning to all. As Marlon mentioned, I'm happy to present to you this work concerned with responsible exit of humanitarian aid agencies from fragile and conflict-affected settings. This is a resume of my master thesis. I will introduce the subject, give you objectives of this project, before firstly giving the findings and methods and the findings of scoping review I did. Thereafter, I will I will present the case study before providing a few recommendations on the conclusion of the study. Let's introduce the subject. Humanitarian world is being challenged by increasing needs, while the founding of humanitarian assistance has not kept the same pace throughout the past years. For instance, in 2021, if you look at the all UN coordinate appeals, only 46% of needs have been covered, leading to ineffective humanitarian aid delivery. Challenged by this, humanitarian take difficult decisions on their field, including when and how to prolong or terminate projects, especially in conflict and fragile and conflict-affected settings, where systems are believed to be weak and collapse throughout the years. Despite policies and guidelines, the withdrawing from humanitarian settings is believed to be challenging and complex, with potentially detrimental outcomes to different stakeholders. And Médecins Sans Frontières, an international medical organization, is not an exception, since it has been challenged since years on its responsibility towards local staff, towards local institutions, and the community when they decide and after leaving a setting. And then someone may ask question on how do these policies and their implementation enable living responsibly. Moreover, looking at the academic discourse, we find out like the body of evidence seems to be new and slim, covering some technical, conceptual, and ethical topics, but the gaps are still exist. The gaps are there in terms of the exit process evaluation, the perspectives of beneficiaries and partners, the link between humanitarian principles and the exit. And to my knowledge, there is no theoretical frame that can describe or analyze a responsible exit. That's why I came up with this project. The aim of contributing in the understanding on how humanitarian aid agencies exit policies and their implemented could enable living responsibly. To do so, I reviewed the literature firstly, then I described and analyzed the MSF's exit policies. And finally, I looked to a specific project exit of MSF from Iraq. Let's look at the scoping review. Which method did I use? I had to GBI guidance to frame the question, the research question, using participant concept and context framework with the idea of mapping evidence and knowledge gap and describing and analyzing, describing concepts and theories with an ultimate output being a theoretical frame that could have a potential to either describe, analyze, or a responsible exit. I searched through 4 databases, in addition to manual search, using mesh terms and keywords. 31 papers were selected based on specific inclusion criteria, and I summarized or synthesized the data through a Prisma flowchart, table, and descriptive format. Let's look to the findings. When we talk about exit strategy, what does it mean? This is a buzzword, which is in the humanitarian settings, as humanitarian arena since 3 decades, with little consensus on what it does mean exactly. I came across more compelling definition by Brodmann, who thinks that it's about organizational business practice of how an agency leaves a community after implementing a program. Which types of exit strategy do exist throughout the story? We have 3 types of exit strategies. The first one, which was popular in the 90s, even if it's still existing today in contemporary aid system, it's a cut and run. A cut and run meaning like it's it is concerned only with technical aspect of closing a project without addressing any local or institutional fragility. And this was the big critique towards this model of humanitarian organization just living without taking care of the environment. And then came up on the agenda the phased withdrawal, which is more progressive, taking care of when and how to live without harming the community, and thinking of sustainability and continuity. And it could be a phasing over, that's a partner take over the activities, or phasing down, or phasing out. Thereafter came, by the end of 90s, the transition model, which was more on when organizations started thinking of shifting their operational model from emergency fashion to more developmental model. And these are the three actors. Let's look at the impact. And then if ill-planned and implemented, exit strategies, ill-planned and implemented strategies could have big impact, firstly, on the community, since the health services may cease or diminish in scope and quality. There as well protection and security concern that may rise, as well as a community economical drop in micro and macro in economy. The second impact will be on the local institution, the partners who scramble to cope with expectation, high expectation for the quality of care and the scope of the care, as well as the salary of the staff, which they cannot afford. Needs are overwhelming, and as well the service that are left behind are usually resource intense. And lastly, departing NGO as well. Within departing NGO, tensions rises, bringing a frustration and sometimes resistance, which may delay decision-making. Talking about the decision, how do organizations make decision to leave a setting? We came across in our scoping review, we came across different factors that we grouped in this ecological model adapted from McNeil, where the decision makers are at the locus of decision making, since they make sense of all information they gather from the environment. But here, the level of autonomy they have, and as well their own emotion, may influence decision making. You have inter-organizational factors which are linked to the organization itself. It can be the organizational capacity, it's going to be the information gathered from monitoring and monitoring information. It could be as well the organizational mandate itself, which doesn't fit with the existing needs. Then they can decide to go. The context is of importance. The local context factors can be security. It can as well the nature and the extent of the crisis ongoing. Global factors has to do with founding policies. It's as well to do with mediatization of crisis. There are some crises that are highly mediatized, and these crises call for more attention because of organizational visibility and survival. Let's go to responsible exit. What does it mean exactly? I came across different attributes of responsible exit through my literature review that I grouped in three three principal functions. The first one is the foresight function. The foresight function has to do with anticipating potential outcomes, anticipating contingencies, and being studious in planning. And there are several elements in this function. The first one is sustainability, which is believed in, throughout all the documents I've came across, is believed to be the overall objective of exit strategies. And this sustainability, or at least continuity, is highly debated in the academic sector, in the humanitarian sector as well, with some humanitarian thinking that it's illusionary to think of sustainability in the world poorest countries, and developmental organization accusing humanitarian of not being sustainable. However, it is the objective, the ultimate objective. It's about as well responsible planning, as I said, and this responsible planning is about early planning at the onset of the projects, or at least as soon as possible, and adjustable plan. The capacity building is important to build the capacity of people who will take over and will continue the activities. The local partnership is of big importance. This has to do with collaboration, level of collaboration of the organization. And this is diverging as well, depending on the organization itself. There are some organizations who use high control, like EU organization working under European unions. You have as well other organizations using minimal collaboration as MSF, where you have total independence and the total different portfolio, different agenda. And then you have what we call networking governance, which is an hybrid model in between who accept to have a level of independence, but work under the same umbrella principles. Lastly, resourcing the exit process is as well of importance. This is in the process itself, resourcing as well the evaluation after the process. The second function, the attentiveness function, is the openness. It's about the acknowledgement of the concerns of people concerned and people involved and affected by the exit. It's all about harms and benefits analysis. It's about monitoring, evaluation, and documenting what is happening. The last function is about responsiveness, which is about orienting and reorienting oneself to emerging needs and in relation to vulnerability, local vulnerability. That's calls for plan adjustment according to what you see in the context, building up as a prevention mitigation measures, and taking care of your staff, because staff may be really affected by exit of humanitarian aid agencies in these kind of settings. I came across as well guiding principles that could foster a responsible exit. There are 5 guiding principles. The first one is the predictability, which has to do with the planning, which has to do with the clear indicators to orient on when to decide on stopping or heading off a humanitarian project. The inclusive participation is found to be of big importance, which has a link with the transparency itself, which fosters respect towards the community and ownership. Flexibility is of big importance, and the fairness towards the community, towards the staff, which has to do with distributive justice. Therefore, if you develop, my theory is like, if you develop these functions and integrate these guiding principles throughout the project cycle, you are able to lead to responsible exit, which is understood as exit a process, not a one-off event, locally led and owned, minimizing harm and assuring continuity. This is the theory we are going to test next in a case study. Talking about the case study, I will start with the methods and then bring the describe quickly the MSF's exit policies, and we'll go to the case itself. In the methods, let's look at the context. I'm talking about Iraq, which is a Southwestern Asian country, which went through 4 decades of warfare and the international embargo, leading to a progressive collapse of all public sector, including public health system, throughout all its building blocks. Although the situation is improved today, 1.3 million people are still in need of assistance since they are still internally displaced. Even though by 2022, the humanitarian community built a roadmap to transition from humanitarian model of operation to more sustainable solutions. And what is MSF doing there? MSF is in Iraq since 34 years with 4 operational sections in Iraq, offering service from life-saving up to chronic disease control programs. And we'll be talking about MSF Switzerland today, which is MSF OCG, labeled here MSF OCG, who looks back 15 years of operations and focused since 2014 on Nineveh governorate, which is the most neglected and most affected governorate, war-affected governorate. And specifically, the project we'll be talking about is the Zummar project, the Talmarak Hospital, who have been handed over by 2019 to a local NGO, which is a DARI, called DARI as a local organization. As study design, I used a single case study where exit of non-governmental humanitarian organizations, the case, and unit of analysis being a Zummar project embedded in a context of Nineveh governorate in Iraq. I drew on document review, my field observation, and informal discussions with some key informants. I used thematic analysis to describe the exit policies, and I use some basic pattern matching logic to analyze the case. Let's go to the finding. What is inside the MSF exit policies? what did I find? I did not find any overarching guidance, and not finding this overarching guidance has to do with the fact that each operational center or section in MSF has a level of independence in itself. But I found 5 documents which are widely used within MSF, and I found great similarities with key attributes of responsible exit I described lately. The object in this document is explicitly said to be responsible exit, meaning like the process of leaving the community is done in transparent, respectful, and accountable manner and ensure continuity of service after MSF left. There are 2 big notions of exit thinking at the design and planning phase, which means designing projects that are based on needs and designing projects in a manner that's context sensitive. All that I mean, it does mean like the project has to be, for example, the resource you bring in has to be sustainable within the context. You rationalize the resource, you build as a level of complexity that can be sustained afterwards. And there is the handover friendly project implementation and monitoring, which has to do with, again, this context alignment. That means the integration of working with the system. It means participation, transparency. It means as well working with national and being aware of national guidelines and the protocols. The decisions in these guidelines, decisions are made based on a set of criteria. These criteria can be contextual, it can be programmatic, it can be systemic. And this is matches what ACE called the consequential decision making, the logic of consequentiality. But it's MSF solely, it's MSF takes decisions solely on its own. I found once this decision is made, what to achieve before and during the exit itself is said to be a trade-off between the investments available and the time frame you have. I found this exit ambition setting framework a bit reductionist, developed by PETS, because there is a context element that's lacks, and I believe like the context plays a big role on what you could achieve during an exit process. This exit process has to be as well staged. Staged means like as well progressive, and a post-exit evaluation is of a big importance. Lastly, the back office duties, which entail security, admin work, and logistic work, are of great importance, and staff duty care is as well of great importance. That's take care of creating a positive dynamic among staff, and as well creating financial and non-financial incentives as well. Let's look at how Zummar project looked like throughout the exit process. Let's start from the decision making. When I looked at this decision, it sounds like what Abramovich called the MSF's right to self-determination, meaning like MSF scan the environment, analyze the environment, do an independent assessment, and take decisions solely to intervene, to respond to something or not, regardless what the impact could be. When analyzing the documents and discussing people, I came across different factors that has driven the decision to leave this project or to hand over this project. And you can see there were major factors that I highlight in black here. Major factor in black that was officially displayed, like shift of security and political control that enabled free movement and then physical access to health services. However, in green here, you see factors that were not officially communicated, and that we found through diverse documents, internal documents. And this, at the first, you could see like it's a consequential decision-making, like it's a really strict analysis of the situation. But the fact that this was hidden at some point, it looked like what Hayes called the use of consequentiality to legitimize a decision or mask real reasons behind the closing that project. But this contradicts what Edwards found in literature, saying like humanitarian organizations lack structure, they are ambiguous, and that they use the garbage can decision-making process. Looking at this exit process on Zummar project through the theory of the build-up, I found it lacked a key responsible exit function throughout the project cycle. It's proved to be an event foreign-led, compromising continuity and minimizing, paying little attention to minimizing. And similar findings were found by Abramovich as well in Liberia in one of the MSF projects in 2006. Looking at the responsible exit functions, the foresight function, first of all, was compromised since the project was not aligned with the local context. If I said that, it's because this was a parallel hospital created in a structure that was not recognized, not integrated within the system, first of all. Secondly, MSF grew in the activities grew in complexity and intensity, resource intensity that could not be taken afterwards. And this was justified, all this non-alignment was justified firstly by the fact that the principle of neutrality and impartiality was important to during the first time, the first period of the war, where the security concerns were of the bigger concern. The second thing is the quality of care, the desire to control the quality of care was higher, is high in MSF, and MSF, that's why MSF try to deliver itself the services they want to deliver. And the third thing of non-alignment, in line with non-alignment, is the fact that MSF emphasizes like they treat patients and not the system. So that's in contradiction with what the call from the Agenda for Humanity, which calls for supporting the system instead of replacing the system. We saw as well the late local partnership. Local partnership, MSF contracted with the local partner only 1 week before the deadline of closing this project. This has to do, firstly, the fact that there was scarcity of partner around. There was found shortfall as well in general. But there is as well a culture in MSF of minimal collaboration. And this is what some argue to say, like, MSF has been created in kind of use minimal collaboration because it's been created in kind of revolutionary mindset. And it's characterized by disobedience and a kind of adversary attitude towards other organizations. There was as well resource shortfall, which was in line with internal funds shortfall and as well human resource shortfall. However, exit criteria was set prior to 1 year prior to the exit. All this created kind of low predictability of the process itself. I saw as well selective attentiveness to the context. Firstly, the risk analysis was MSF-centric and not taking into account all of the community part of it. And the context analysis for me was twisted as well, because why arguing to leave a context because the health system has gained its capacity. In the end of mission report, MSF was still saying like there was no capacity to cope with our population's health needs. However, the program monitoring was well done, and there was a post-exit evaluation done as well. Responsiveness was as well selective, since although the community, the local leaders, and the politics asked for MSF to extend at least for one year, for example, this was not heard by MSF. And there's as well a kind of discrimination towards some staff, medical staff, who had special contracting arrangement, but they could not be taken out in any kind of financial incentives at the end of the project. All this compromised flexibility and the fairness within this process. And lastly, we found like the participation was instrumental, which hindered as well partial transparency. In sum, I found like there was a tension between MSF's operational model on this project and the so-called responsible exit that is well described in MSF exit policies and as well in the literature outside of MSF. This being said, I would recommend to humanitarian NGOs to shift attention from why to how to intervene. this by improving contextual attentiveness and responsiveness. And here I call the relief development transitioning framework adapted from Brickerhoff. Although MSF may come in when during the chaos, when it's legitimate to bypass the system and directly deliver the service, as long as the situation evolves, MSF should read carefully and adapt its operation, at least towards restoring best service and integrating the system, or handing over as soon as they can to the system. It's also important to clarify the terms of accountability, especially toward local institutions and communities. There are needs of testing further this framework, and as well the mind other research gaps that I've talked about. In conclusion, as I said, there is a need of research since the body of knowledge is new and slim, and there is knowledge gap. I formulate the essence frame as developing and enacting the foresight, adaptiveness, and the responsive functions while integrating transparency and inclusive participation in the project cycle is likely to lead to closing responsibly. However, throughout this case, there was a misalignment of MSF's operational model and responsible exit, calling for rethinking on the operational model. However, I may ask a question now is how possible and feasible is this? How possible and feasible is aligning this operational model towards responsible exit in ever-changing context while ensuring enough humanitarian space in a contemporary humanitarian aid? I'll be happy. There may be people around here who work to bring some thought about it, and I'll be happy to answer any question. Thank you. Over, Marlon.
Sorry, this is, thank you, Joseph, for the presentation. It's clear enough. We have a couple of questions. I will try to organize in a sense that match with your presentation. First, as there is a couple of questions looking into the phase that you call in your framework foresight. Yeah, in the foresight phase, the question here is about if there is a more specific recommendation in order to ensure smooth program coordination when you enter into the country. This is probably, according to the person that asked this question, is Elizabeth, you know her. This could all help in the exit strategies. What do you think?
Yeah, that's a really good question. I think if I understood well, it's about at the entry point how to properly foster coordination and then to be able to have a smoother exit. I think, as I say, I mean, the whole thing is about being clear on why do you go somewhere. That's one thing. Is it a need-based programming? Which needs did you go for? That's the first thing. The second thing is, how do you read about through your assessment, how do you make this assessment participatory in order not to involve key stakeholders within your first analysis of the needs and the vulnerabilities, and involve these key stakeholders from the start, so that they feel like kind of ownership over it. So you start building as well the capacity right from the start, and being a bit humble as well, because when we come in as a humanitarian, you say we do things, but being humble, like there are capacities there. You build on what is existing instead of bringing something that may not be sustainable, or bring a resource that's already existing somewhere that you could use internally. That's what I think that will build a kind of sustainability and build as well trust towards the organization to go together with local stakeholders for the exit.
Okay, thank you. there is, in fact, related to that is what is the role or the responsibility of the street level bureaucrat in this entry phase or in the implementation of the project, and how far this has been implemented in the project you study in your thesis. In the research you conducted, what you found about the role of street level bureaucrats.
Can you hear me?
Yes, I can hear you. Yes.
Yeah, I mean, the street level bureaucrats, they are of great importance at the start. So because they hold important information on the different vulnerability, different needs within the community, and evolving them from the start, the discussions is of great importance, because you will not miss important needs that you may have, and they are the interface as well with the community. So involving them within all process from the start is of importance. And if great participation of different stakeholders have been used in the past, in MSF, of course, it has been used in the past. So there are some great examples where there's been some level of participation, but still a lot of many projects where we come in during the chaos, and which is important to come in to do things. Then we design a project, we do it, but then afterwards we try to go to them and try to ask questions. But it's a kind of instrumental use of people to instrumental participation.
But if I understood in your presentation, you say that in the case of Zummar, it was more an instrumental participation. And how you can explain that? Where this comes from?
Yeah, that's great. So I talk about instrumental participation because any participation, that's a form of participation I saw was for a specific reason. And it was a specific reason, first of all, to get information. That was one thing. The second thing was to gain acceptance through the leaders. That sort of thing. But it was lacking real space for participating, space for ownership, space for decision as well, participating within the decision. So that's why I found it kind of instrumental, using kind of group of people, muktars, like local leaders, to gain their trust for the community. But in the return, when the exit came on the table, and then they were not happy and asking you a 1 year delay in it, the same, we didn't hear them at that moment. So it's kind of, yeah.
This link, the next question from Diego Tacne, this is how often are those coordination realized within the country local capacity building during the mission? Is it really something that is implemented since the beginning, or is still improvement to do in this?
Can you come again? So sorry.
Yes, the question is about how often are this coordination happening? Because as you say, there is a kind of instrumentalization of the country or local capacities. And if you know in your experience, there is NGOs that are already conducting this kind of plan since the beginning when they go to the country.
How to say that? I'm not sure if I understood very well the question, but you're still talking the participation, right?
Yes. But in the coordination, if there is some NGO that already have developed this kind of phasing up.
There has been NGOs like Oxfam or other, I could say like IRC as well, who have developed a kind of participation level and really trying to build together, to co-create some of the projects that's maybe self-sustained afterwards, even if they come in emergency, but they build it together. So but then the level of participation, again, you have to be in there. What is report is one thing, but then how far they've been able to. But even in MSF, discussions are ongoing to really to move towards more engaging in the community and then engaging with the strict bureaucrat. This is a new, I mean, I would say, there's a new generation of people pushing a lot to go towards kind of a community engagement, what it does mean exactly, and where do we put passion within this?
I understand, thank you. There is also two questions related to how these exit strategies or responsible exit strategies have impacted the host countries or population is in terms of, in fact, in terms of evaluation. Because one of the questions is, do you know that there is already a strategy that has been evaluated? And the other is about how to ensure that the methods of this evaluation, and that somebody asked that your study was conducted after the exit phasing of the project, and wonder how the key informants were recruited. Maybe it's about the methods of your thesis.
Yeah,
then this maybe you can a little bit later. But for me, I want to share with you that indeed, according to the research, one of the challenge is the research showed that exit strategies are very hard to do well, and this is Hyman, and one of the challenges is the after evaluation, and then is indeed suggested that evaluation is done after a certain period of ending or closing or exiting the country. Then what experience you have in that, or what you found in your thesis work, Joseph?
Yeah, evaluating the post-exit evaluation is a big topic. First of all, it's well recommended by all the guidelines, all the papers recommended like to do exit, post-exit evaluation. MSF talks about 6 to 18 months after the MSF's departure from a project. It is always difficult. You know, you work in fragile in the conflict affect settings. There are many factors that may influence the outcome 6 months later, 12 months later. It's not only linked to what you have done as an exit strategy itself. How to say the causality there is no, it's a multifactorial. But in terms of methodology, it's always about bringing someone external to the mission to come in with a methodology. You will do observation, you do interviews in the focus group to observe himself as well, and then read reports and read medical data to try to analyze how far the intended objectives from the exit, and they see the current status after exit. What is the decalage? What is the gap in between? Is there a big drop in the quality, a big drop of this, big drop of that? That's what is intended to be used, but it's not often that's exit are evaluated for several reasons, because of resource as well, because it's not planned at the start.
Yeah.
And the second thing, people are busy, resources are busy to be in other emergencies, so they don't find it easy to come back. And the third thing is, like, when you come back, you raise expectations as well, because from the population, that's another fear that is documented throughout the literature, why people do not come back to evaluate.
There is in the literature also the fact that, as you say, it's not planned and also it's not funded. Often we don't plan funds to do this evaluation. I have a couple of questions that are related to. Let me try to look at the chat, because I have some difficulties. Okay, to find it. Sorry. There is a question about more or less the principle of the NGO. But what I want to share with you, that is according to Gross EVA, She is a senior analyst at the European Union Institute for Security Studies, and she stated in her research that the term exit strategy is somewhat misleading because it implies a predefined end or a kind of obligation to end and a kind of a deadline. And this in such kind of context that are very unstable and complex. My question or reflection is, looking at your framework, is that design possible? Is that the foresight phase feasible? Or thinking first in the principle of the humanitarian organization, and second, especially in the context itself, that you don't know when this will be possible. Then what do you think, Joseph?
Yeah, that's a good question, Marlon. I tend to agree that the words can be misleading. I don't stick to words like you can call it exit strategy, you can call it whatever. It can be misleading. I do agree, but I think what I believe in is, although the context may be changing, although it's difficult, the exit from a setting for humanitarians will happen. Because, as I said, humanitarian foundings are scarce. There are other questions somewhere else. In terms of proportionality, we'll see maybe the needs there is bigger, we will go at one day. So having the exit thinking in the mind, and incorporate this exit thinking in the project cycle is of importance. And that's where the foresight comes in. Like, you think of it at the start. For example, if I want to go to a hospital, I go to work to open a secondary facility as a humanitarian, I can think if there is possibility to integrate existing structure, I will rather integrate an existing structure rather than doing something in parallel. That's what I think of exiting, that you're planning ahead, you plan that I will be leaving, and I leave something here. So that's what I call for. Not coming, I know we come in emergency, we do things, we save lives, which is good. But as soon as things start to improve, they are very much around us and improving, we are more or less left in our way of doing, and then we are not in the phase with what is happening in our environment. So what I mean.
Yes, I understand you very well. The point is always, yes, I have also a question from Marjan, you say that in your final visual model, you foresee 3 phases. It's more or less related what the previous question was. The first phase is a truly participatory approach and looking to a health system strengthening logic. But she said that in the first phase, you are confronted with an emergency and chaos, and that seemed to be used as argument for a non-participatory approach, assuming not capacity is available. This is a wrong start to the main problem. What do you think?
I don't think it's maybe the wrong start, because the thing is, in the middle of the chaos, and it is the context dependent. In the middle of chaos, people are under trauma, people are forced to be displaced. So at this level, participation sometimes is not. Maybe you find that the local health authority, they are not around there. People have left. So it's somehow legitimate to start something and to save lives. But what I call for is attentiveness and responsiveness to the environment. As soon as things start to build, they start building back little by little, rehabilitating the system. That's, you start slowly. For the example of this Zummar project, for example, as soon as there was a shift of authority, the situation improved. So maybe that was the time to start integrating to the system. But what happened was, like, when we decided to leave, then we said, now we'll integrate about 3 months, in 3 months, So it's this thinking throughout the project cycle which doesn't say like we have not to do emergency and we have not to save lives. We have to do that.
Yeah, thank you. There is two questions that are linked more or less. Is when the fact from Bishia, there is the fact is she asked if do you think that we can use a transition strategy to make this term more noteworthy first? And I think this term is used for some agencies. And Emanuela also think that perhaps the responsible exit strategy should be one of the activities inside the project and to be inside the health system with relation with the local authority. This is about specific recommendation how to improve probably the design and second implementation. Yeah, this is transition. I know this is used for some agencies, but
yeah. I think throughout my thesis, there are many terms interchangeably used, and depending on which organization, transitioning is one of the terms. That's, for example, some platforms like interagency committee, standing committee of UN use as well transition. Yes. In their mindset is the fact of transition from emergency to more health system strengthening models. So it's a shift model.
The operational shift.
Yeah, operational shift. And others will talk about exit. Others will talk about viable exit. I'll call it ethical exit. There are many terminology. But what I think is important is the mindset behind that. All these documents talk about sustainability. But do we really foster sustainability throughout the project cycle? Do we build the elements of sustainability? That's the whole question.
Yeah. Okay. Then, in your opinion, the exit should be one of the activities of the project.
Yeah, for me, from the start, there should be exit thinking from the start, even if it's not. If it's not a person dedicated for that, but the head of operations should be thinking of a strategy. And normally in the project document, there should be a section on exit strategy and discussion started on exit strategy every year when you're working on the action plan. So that's you evaluate what you're doing toward the exit strategy. Of course, it should be the activity.
Okay, then I see where we are arriving to the end of this discussion, Joseph. I have a last question for you, more a personal question. I know that you have been working with international NGOs several years of your professional life, and you have been interested in the health system perspective, health system strengthening, which is sometimes framed as contradictory perspectives. And after your master, Joseph, and this thesis that has been laureated with the prize to the development, what do you see for yourself? What is the future? What change or not?
What change or not? I think already the decision of coming here to do this master was kind of after seeing what is happening the other side and participating to the discussions and seeing how far discussion can be pushed or not within this organization. I said, I have to step back and come back and then learn some basics and then try to see what is supposed to be done at one point. So, yeah, after this master thesis, I think, what is my positioning? My positioning is like, with all the debates, internal debates within this humanitarian organization, there is a better way to do things. And that's I believe there's a better way. And there are many people inside the organization fighting for better ways to do it. But this change will take some time. But we need people as well to do this change, to push for this change. But of today, I think the work of humanitarian is important. They need to do that. In middle of chaos, is Ukraine, where you're going, you need someone else to be there. But there is need of changing way of working. I'm not sure, like I'm keen to continue doing humanitarian for coming years, but I'm keen to look at more system-wise thinking, and because I believe like we are within a system, we are not a system, we are within a system as NGOs, and we need to work towards that. Yeah.
Okay, thank you, Joseph. And then nice again and very honored to be here with you. And I leave the floor to Charlotte.
Well, it's now up to me also to thank Joseph for presenting and sharing your master thesis insights, and also for getting into this dialogue with the audience and also with Madelon. So thanks also to you, Madelon, for your interactive and enriching moderation of the webinar. Again, also thanks to Yves for your always very much appreciated technical support and assistance. Also thanks to the participants, you participants from around the globe for attending this webinar. We also would like to ask you to complete the short survey, which will be displayed. And of course, we give you also a rendezvous for our next second upcoming alumni webinar in this new series, which will feature the research of also MPH alumnus Calvin Tonga from Cameroon. And it will take place on the 6th of October from 3 till 4 p.m. Central European Summer Time. So we hope you will be joining again. Thank you to all, and stay safe and healthy in the meantime, and looking forward seeing you back. Thank you.
Thank you to you, Charlotte. Bye.
Thank you to all. Bye-bye.
Thanks to all of you.
Thanks.
Yeah.